Hi, my name is Shabnam Dietrich. I'm an RN at the Yolo Adult Day Health Center, and I would like to show you bag technique for when you do your home visits. So as usual, when you're going to start any sort of patient care, you're going to want to do hand hygiene. Get your hands all clean. So you greet them at the door, you've come in, and the first thing you're going to do is you're going to look around and you're going to see where can you set up for your home visit. And that's actually going to be one of the hardest parts. Because you're not going to get a clean table like this. You're going to get couches and chairs. We don't want to be setting our bag on the ground, but couches and chairs are all right because we have our barriers. So in your bag, you are going to have what is considered a non-clean section or dirty. And that is going to have your barriers in it. So you're going to grab a barrier. Once you've figured out where you're going to set up, you're going to lay out a barrier. And that is going to be for your bag. So place your bag down. Now you're going to need two more barriers. One is a clean zone and one is a dirty zone. You're going to be constantly thinking in clean and dirty. What has touched the patient and what has not yet. So I'm going to pull out two more barriers. This I will have be my clean. And this will be my dirty. Now, other than this dirty zone of my bag, everything else is considered clean. Not sterile, but clean. So I'm going to zip this back up. So before you go into your main compartment, you need to hand sanitize. And it's best if you're never going in with gloves on, because unless you know that you have just hand sanitized and put those new gloves on, you may have done patient care and not realized it and then gone back into your clean section and now you've made it dirty. So I've hand sanitized, I've opened my bag, and now I'm going to pull out what I need to do my patient care. So we're going to get a stethoscope out. A thermometer. So I've set out all the supplies that I'm going to need. I'm going to close my bag back up. And now it's time to perform patient care. Hand hygiene. And then gloves, which I have in this section here. This part's fun. Your hands are still wet? Okay. So, as you use your equipment, hi, I'd like to take your temperature. Oh, I thank you. Oh, great, you are fine. Good. We're going to set it back down on our dirty area and think of it as dirty. And the same with our stethoscope. Call for me? Okay, good. Excellent. Into our dirty zone. All right, so now I would like to clean my supplies and get them ready to go back into my bag. So, taking off my gloves. The other thing is you're going to need to find a trash can in the home that you're using. If a trash can is located under a sink, I don't want to be touching it and possibly bringing my germs, taking back their germs. So you might leave things on you might make another barrier on the table and have that be your trash can. And then you would put your gloves there. I'm just going to put it on my dirty one for right now. Otherwise, sometimes they already have a trash can out, and that's great. You can just go ahead and use that. So my goal now is to clean my dirty supplies. So I'm doing hand hygiene. So this is the time where I'm going to go back into my bag with gloves on, because I know I just cleaned my hands. But at the purple top wipe, I don't want to touch with my bare hands. And you're going to start with the cleaner part of the equipment, which is the ear pieces here. And we always want to clean from clean to dirty. So the part that touched the patient is considered the most dirty part. It's cleaned last. now I'm gonna set this on my clean barrier and give it time to dry. And then I would continue to clean the rest of my supplies and then put them on the clean barrier to dry. And then once they are dry, put them back into my bag. In the interest of time, I won't clean all my stuff, but yeah, so just kind of be thinking clean, dirty section of your bag. And when in doubt, hand hygiene, just over and over again. Okay, hopefully this was helpful. Thank you for watching.